Hi, my name is Dr. Mirrafati from Aesthetics again. I've been asked a lot and I get commented a lot as to how much does a breast augmentation cost, particularly because in our area, in Orange County or more so Newport Beach, Costa Mesa area, what is the cost of the breast augmentation? So I decided to do a video to talk about the cost of breast augmentation and what are the different type of implants and pertaining to cost, and again, what are the most cheapest or the most expensive place that you can go get a breast augmentation. So one of the common thing is why breast augmentation so expensive? I guess when you think about it, you have companies that are producing implants go inside your body for a long period of time. So if it's silicone, for those of you that remember the downfall of Dow Corning silicone implant, the shell that broke and silicone sort of went over the body. Now the newer silicone has a higher syntoscope or viscosity, and the shell, and when you cut it, it doesn't break. I've done another video of this. You can always refer to that video comparing different type of the memory gel or the implants that when the shell breaks, or the gummy bear implant that even though the shell is broken, the silicone stay together. So generally, saline implant are a lot cheaper than silicone implant, and within the silicone implant category or memory gel implant or the gummy bear implant, you have a different grade of implant. You have the high profile, extra high profile, you have the boost implant, and this is basically talking about mentor implant. So they do cost a lot in terms of just the cost of the implant itself. And then obviously you have cost for the operating room, because obviously it's a sterile technique and it's a sterile procedure. It's not like you can be done in an office visit. So you have to go to a surgery center, accredited surgery center hopefully, or a hospital to do it. Most of the time it's not done in a hospital because obviously they cost because overbearing, and there is no need to go to the hospital for this because the surgery generally is about 30 minutes to about an hour, and some doctors are a little slow and theirs is about 2 hours, but still it's done in an outpatient surgical setting, and that cost, especially if it's that surgery center is credentialed or HHC certified and so on and so forth, which hopefully you do choose to go to a HHC credentialed surgery center, which it has its own guidelines for safety under state of California. Then you also have anesthesiologists. Obviously you want to have board certified anesthesiologists to come in, and then you have, so anesthesiologists have their own set of fees. Then you got the nurses that are circulating in the room, and then you got the surgical assistant that's in the room trying to do the things to help the surgeon to do the surgery. Then in the recovery you have also people that help with the recovery as well. So those, considering it all, there are certain costs involved with doing breast augmentation. Now generally in Southern California, in Newport Beach, Costa Mesa, or Orange County area, I think LA area is a little bit more expensive because of the cost of living over there is more expensive. But a breast augmentation runs anywhere from, if you're doing saline to silicone, runs about $8,000 up to $14,000. Now they're all the same implants. Some doctor charges more for whatever reason, but it runs anywhere from $8,000 to $14,000. Here at Mirror Aesthetic, my prices for saline implants is about $6,900. Silicone is $7,900. Silicone is $1,000 more. So my prices is anywhere from, I would round it off to from $7,000 to $8,000 if you're doing straight breast aug with lowering of the fold, which basically encompasses all of the breast aug. That includes the operating room, anesthesiologist, recovery room, the whole fee. It doesn't really have any hidden fee involved with that. So in my clinic, it runs anywhere from $6,900 for saline up to $7,900 for silicone. That is right now. The prices can vary, go up and down, but I don't see it to be changing that much in the next few years. So it's probably going to be the same. Now the question is, if you do need a breast lift, then the prices is going to be different. Now, the other question and a topic that people talk about, is it cheaper to do breast augmentation versus breast lift? Now, breast lift is always more money because it takes longer to lift the breast, and then obviously at the same time you put an augmentation. Now, not everybody needs a breast lift. I have a patient coming in and say, oh, my breast is dropped. I need to do a breast lift. You really don't need to do a breast lift for a lot of patients. You can actually do what we call internal lifting or lowering of the fold, where you, by bringing the inframammary fold lower, you can invert the breast and make it a shape of a breast lift and the image or a look of a breast lift without actually having that scarring. Now I will do another video explaining the whole thing about breast. So breast lift generally it costs about $6,000 to $7,000 more if you're combining it with an augmentation. Another common question is, and I've been asked this, what are the cheapest state you can go? So I don't know why people want to try and go to the cheapest place possible, but a lot of the Midwestern places, Arkansas, I think, Ohio, South Carolina, those are the places that I guess the cost of living is lower. So therefore, obviously, the cost of the implant is going to be maybe for about a few $1,000s lower, which basically brings it down to the price we're actually charging in here. Now, the reason I actually can charge that low is because I work on volume. I do a lot of breast augmentation. So my prices runs anywhere from $69 for Saline, $79 for Silicone. One of the most common thing people ask again when they do call, what is the most common way people pay for breast implant? Obviously it's cash. There's no insurance involved when you're paying for breast implant. It's a luxury surgery, you know, insurance doesn't cover it, right? So people generate a little bit of a saving, but they are also financing option available, such as CareCredit. There's another company that's really good called Cherry. Now I have it on my website. Cherry is not a financing company, it's like a payment plan. And you can literally go on their site, and it takes maybe about 2 minutes to fill out the questionnaire. And if you've never written a bad check, they sort of just look at your history of your deposit that you have, and if you have a somewhat of a deposit that you can afford their payment plan, they'll give you the option of Cherry. So Cherry is sort of a payment plan. There is no prepayment penalty. There's no accumulated interest charges. So I like it a lot because it's really straightforward. And again, if you go to my website, youngerlook.com, under financing, there's a link for Cherry. You can literally go fill out application. It does not hit your credit. It's a soft check. And another option is CareCredit. They're the two biggest that I know that I use because CareCredit has been around for a long time. Now that is a financing thing. There might be some prepayment penalty involved with CareCredit and the interest rate just to be just a little bit higher. But Cherry is a payment plan. Some of the patient also, I've seen this, if they work for the school district, they can go to their bank that basically the school district is affiliated with, and they get a really low interest rate, right? So they go to the bank and they get this through their own bank, or they refi their houses if they have house, because the interest rate sometimes a little lower when you do this. But Cherry's interest rate is about 14%, and I know it's a little higher, but still it's not as high as what some credit card interest rate is. So it's about 14 to 15%. CareCredit is a little bit higher, but still lower than the 25-26% that credit card interest rate is. So the options are basically you have to pay cash up front before the surgery, or you can finance it. You can pay some of it from your saving and some of it from CareCredit or Cherry. The length of the term generally is about, you can do it for 6 months free interest all the way up to 4 years, and there are some with some good credit you can extend it to 5 years, and basically and there's no penalty. So if you do come up with some maybe tax rebate, whatever, you want to pay it off, you have an option to do so. So to summarize, how do people afford breast implant? Basically it's an elective surgery. No insurance is accepted in this case. I guess for your blood work, you can probably use your insurance, but that doesn't cost that much. So how they afford breast implant is they're saving, CareCredit, which is a financing option, or Cherry, which is a payment plan. And all of these are on my website, and you can fill it out. There is no, basically you're not obligated to use it. At least it lets you know if you are approved or not. Okay, stay healthy and stay well.